introducing a specific targeted group to the school-based health and wellness center, and then identifying need. This can be choosing a group that you all want to bring in to your health or wellness center. So it could be incoming ninth graders. Maybe it's like you want to get a pulse on all the young folks that are coming into the high school for the first time. It could be sports related. You could do it with all of the football players. So you can really choose which group you're trying to reach based on what your screening goal is, what you're screening for, and kind of the folks that you're also trying to hopefully bring into the school-based health center and or wellness center. I'll be using those interchangeably as well, as Sang mentioned. Okay. Go ahead. Okay, so these are the different models that I'm going to be going over today. They go from least labor and resource intensive to most labor and resource intensive. And again, just to kind of like I mentioned with the goals previously, that this can change over time. Maybe you're starting out, you're just opening up, and you just want to screen students when they're referred for services, which we'll talk about as kind of the least labor and resource intensive. And a great entry level for screening. But over time, maybe you'll have more capacity and you'll be able to move further along the continuum and perhaps provide screening during a school-based health or wellness center tour. So just to know that there's a lot of different models out there, and knowing that you don't have to choose one model and stick with it. You can change based on where you are at your school-based health or wellness center, you know, who you're screening, what your screening is. It can really vary depending on where you are in that point of time. All right, option number one, screening when students are referred for services. So this is if a young person is coming into the school-based health and wellness center, registering, and oftentimes this is part of the registration packet. This is more individual level. Sang was talking about population level screening. I would say this one is more of an example of individual level screening. It becomes a standard part of the registration protocol. It usually includes some health education after they fill out the forms for registration, their screening forms. They would meet with a provider, and the provider could talk with them if there are any areas that need to be further discussed. And yeah, so they would meet individually with the service provider. The pros of this is it less time and resource intensive than other approaches. You know, this can really be part of your regular registration process. This screening can be just part of that paperwork that they're doing when they fill out for the first time when they're coming in, or when they're coming in for an appointment. So there's not additional logistics really that are involved. No school coordination challenges because this is happening specifically and only at the school-based health center or wellness center. And the screening is standardized. Again, part of the process and it's one-on-one with the screening provider, which is great. They get that one-on-one time. It doesn't increase reach or visibility of the school-based health or wellness center because the young person who's coming in was already planning to come into the school-based health or wellness center. It's not reaching new students. And then it's more of a reactive versus proactive approach in that, again, you're waiting for the young person to come to you rather than going out to the school to reach those young folks. So that's the first option of screening model, which is screening when students are referred for services. The second one is screening in the classroom. And what this can look like is it can be when I did it back on site, we had our program manager who doubled as our health educator would go out to the classrooms and provide the screening. Oftentimes they would do a whole class presentation. It would be of the school-based health and wellness center in general, the services available, and then give a purpose of the screening, and then you would distribute the screening throughout the students in the class. You can, again, provide some health education during this, but the education wouldn't be as specific because it's not one-on-one. It is going to be more of a group setting. So it'd be more general. And yes, there's a lot of different models. Sometimes we did it in hard copy if your school has access to like, what are those called? Like iPads, then they can do it electronically. There's a lot of different formats that you can do for screening in the classroom. The pros to this is that it's less time and resource intensive. It's a little bit hard because we're on a continuum, but the next one when there's a tour is a little bit more because You're asking for the students to use class time to travel to the school-based health center, come to the school-based health center, and then come back. So you have to do more coordinating. You have to close the school-based health center or make sure you're scheduling it when there aren't appointments so that everyone can come in. So it's less time and resource intensive in that sense. You definitely reach a larger audience more quickly. You're going in, you're giving a presentation, you could screen 30 students in one go. So it's really time efficient. Easier for administrators to agree to a one-time interruption because you're going in. The presentation I would say can vary. Like I did ones that were less than 5 minutes, and then you could do where you don't even have like a PowerPoint or anything. Or other times when we were going in to do more robust ones, maybe it would be like a 30-minute presentation. So, but you can really vary it based on the classroom's needs or what their other things are that the teacher needs to cover that day, so that it doesn't cause too much of an interruption. And this is a more proactive approach because you are going out into the classroom to provide this rather than having the young folks come to the school-based health center on their own. The cons are that the students don't visit or enroll at the health center or wellness center, and I've already alluded to this tours, which can have multiple benefits, and we'll talk about in just a moment. But this is doing it in their classroom, so the students aren't getting to see the school-based health center or visit. So that is still kind of that, if they've never been before, it can be intimidating to go for the first time. And then they're missing the experience of getting to know and build a relationship with staff or providers. They're not getting that one-on-one time that they would have gotten had they gone to the school-based health center, because they are just having that one staff provider with that group of 30 young folks, which they're not getting to really build that relationship with the provider. And now transitioning to the tours, which is the ones that I'm excited about. This is what we used to do when I was on the ground, and we would actually do this. So all our incoming 9th graders received sex ed, and it was through their English and their science. They had to do in 2 classes simultaneously in their English and science classes. And so as part of, I would partner with different teachers depending on the year, but as part of that, we would have them come to the school-based health center. So towards the end, they learn about resources, and then, their best resources is the school-based health center that's right there on their campus. And they would, I would partner with the teacher, and they would come to the school-based health center to get a tour. So this is the entire class, or you can do smaller groups, coming to actually see and walk around the school-based health center. Our school-based health center, at least one of them, was pretty small, so we'd have the whole class come, but we'd split them up into smaller groups because they couldn't all fit into the health center at once. If you have the space, you can set up stations for students to get familiar with the wellness center, school-based health center, and they can be really hands-on and participatory. So maybe you would have one station where you would screen young folks. One station could be a condom demo. One station, it could be like resources for behavioral health. And this is a way for them to not only, instead of just hearing about the services that the school-based health center or wellness center provides, they could actually see and experience those services. And then you can also make this part of a career exploration. So a lot of times young folks, when they think of, like a health professional, or they think of a doctor or a nurse. And so oftentimes we would introduce them. We did it more through panels. It was with the folks that, or the young folks that got the tours, but it wasn't at the same time. But we would do a panel of our medical provider, which was a nurse practitioner, our medical assistant, and our behavioral health provider, which was a LCSW, licensed clinical social worker. And so they would have a short presentation and a Q&A. But I think that is definitely something that young folks can be interested in, and a great way to connect them, if not directly to access services through the school-based health center, just to learn more about health services in general. And so the pros, the students become familiar with the school-based health or wellness center and staff, which definitely can lead to future visits. When they have been to the health center, they know the folks that are there, or maybe not know, but just will recognize their faces and kind of have the look and feel of it. They'll feel more comfortable in accessing. It can be hands-on participatory, as we already discussed, and it can provide opportunity for career exploration. The cons is that it can be more time and resource intensive. And as I mentioned, the young folks have to take time to come. to the health center and do the tour. It's a little bit more interruptive for class. Also, trying to coordinate with services being provided at the health center to make sure that it's not on a day that you're providing services and have to stop services for the young folks to visit, because you don't want those to happen simultaneously. The students don't register, which is the last most intensive option that I'll get to in just a moment. And then they're not doing an individual person-to-person screen. So this this screening with the tour is still group-based. They're not meeting with their provider individually. So there can be a loss there. Okay, and the last option is screening during a school-based health or wellness center tour, including registration. So this is basically the thing that I just talked about, plus you're registering for the young folk to become a patient at the health center. So when we did this, I would recommend doing it as two separate events. So we used to go into the classroom to register young folks prior to them coming for the tour and doing the screening. At that time, our registration paper work was pretty robust. We had quite a few screenings, and so it did take a decent amount of time, I would say. It also allowed us to then go back and review all that paperwork, enter it into our database, so that would already be in the system when the young folks came, and then also to catch and see if there was anything missing, and we could follow up with them when they came for the tour. So yes, it can happen prior to the visit. Again, they can come as a whole class or in smaller groups. I think that kind of depends on the class you're coordinating with, as well as the space in your health center. You could do the stations again. And this one, the added plus is that they will receive a one-on-one visit with the provider. So because they are now registered with the health center, and they've done this screening, the provider would review the screenings ahead of time, and then could meet with each student regardless of what the outcome of the screening was, but would have that one-on-one time with the student. And depending on what was discussed, it could be a potential billable visit to either Medi-Cal or Family Pact. And so lots of pros here. The students become familiar with the school-based health center, wellness center, and staff. So same as the previous one, even more so though, because they are getting that one-on-one time with the provider. Students are enrolled as patients, which can lead to future visits. Once they're patients, they've done that heavy lift of doing the registration paperwork. Now it's just easier for them to come back in. It increases the percentage of students served. And this is, I think, that's really, really the key and the highlights of doing it this way. You're really expanding the reach into the school and then identifying students that would not have come through otherwise, registering them, and then being able to meet their unmet needs, to connect them to services, to get them connected to behavioral health therapy, whatever they may need. It's a great way for new school-based health centers to get more folks in. So just a really the main pro for this one, and a really big advantage. And then also, I guess this one is too, is it can be a billable service. Because it's not only individual person to person, they are also now registered, so that way you can bill the visit. The cons are that it are more time and resource intensive. You're going potentially twice, once to do the registration paperwork, then once they're coming to give the tour. So there's a lot more coordinating with the school. And then you can have pushback from schools if enrolling students into Family Pact, because that is sexual and reproductive health service related. I think that this is something that you just really have to get a feel for at your school. I mentioned we did those 9th grade tours and registration, and this was never an issue at our school, but just something to be aware of if it is your first time doing this. And so those are the 4 models, and just wanted to take a moment to step back and think about just screenings can be an awesome way to get young folks into your health center, especially if you're in a school-based health center. And there's a lot of innovative ways to do screenings. I think we named some, but you can also host special events. You could do a health fair for the school. There's grade level. I already mentioned that with the 9th grade example that I gave. There's a bunch of different types of screenings, and actually, this is my last slide. I'll drop it in once I'm done. I have a link to a screening toolkit website that we have. And on there's a list of like what is recommended by various organizations to screen at certain ages. So I'll drop that in just a moment. And just to make it fun, an example of this is one thing we call it tacos and testing. It was literally like, get an STI screen, get a taco. And so it made so many, we almost ran out of tacos, to be honest. Like, it made so many young people come in. And it was also a great way to destigmatize STI screening, because people were like, oh no, like, I'm just going because I want a taco. It's not because I maybe need to go. It's more like I'm just going for the free food, which everyone loves, right? And so it was a really great way to like destigmatize and make screening fun. I think the last piece that I want to say is, screening screening makes a significant difference in students being identified and linked to services, which we kind of already know and have touched on. One thing I do want to mention though is just to also think about your capacity if you're doing a large population-wide screening. So if you're doing all of your incoming, so we did a few different screenings. If you're doing a whole class or the whole school, just to be prepared, like what might it look like if you have more positive screenings than negative? Like, just to kind of think that through, prepare your staff, have resources. Definitely like great to do screenings. And I just want to do a caveat of like, when you're doing large screenings, to also just be prepared about the influx of follow-up that can happen after that, and just to help train your staff and then have resources on hand so that folks feel supported in that follow-up process.
Yeah. Sarah, I want to just add 2 quick things before we turn over to Jennifer. The make it fun part, Fremont High School in LA would actually do like during the Halloween time, like they would decorate their whole wellness center with a Halloween theme, and sort of made it scary and did STD screening as a scary thing, but with Halloween. So like that was really fun. The students really loved that. And then the other thing that is sort of, you talked a little bit about the classroom-based screening and just sort of like a school-wide screening. So I didn't put this example in the slide because it was such a unique, scenario, but a number of years ago, there was actually a chlamydia outbreak in South LA, and I won't mention the school name, but because of the outbreak, what had happened was the LA County Health Department stepped in to help, because we really needed to identify where the outbreak was and really stop, because chlamydia is quite serious. And so what they did was public health nurses would actually come into the school campus, and then during a core period where every student has sort of like that home period, they did like a 50-minute classroom presentation on, chlamydia and other STDs, just sort of as a health promotion unit. But then during PE classes, which everyone also had, they basically had all this, each student was given a urine cup in a brown paper bag. Everyone just basically went, through the bathroom stalls and were asked to provide a urine sample. But students who really wanted to opt out, because you couldn't force everybody, who wanted to opt out, didn't have to worry about being stigmatized for opting out or what have you. They would still go through the bathroom stalls, but just, not actually provide a urine sample. And those were collected. And, there was an 8 or 9% positivity rate, which is really, really high for chlamydia. And so, and I remember, the county and LA Unified actually ended up writing a case study about it, because it was really an interesting approach to stopping the epidemic, but also being able to provide, that health education, done by public health nurses, doing really school wide, but also doing it systematically and organized. And again, it helped to reduce the stigma, but we were also able to catch, where some of those positive cases were. And then with chlamydia screening itself, students who were screened positive were given treatment along with their partner or partners, right? This is where you actually can do the partner treatment piece. And so, I always think about you know, that particular example, just because that, what like Sarah said, you have to think about the capacity to do it. And in this case, it was in partnership with the health department, but then the return on investment, right, was huge because you're able to then really intervene early, or at least intervene in a way that could help, prevent, some serious, impacts of having chlamydia. But anyway, thank you, Sarah. I just wanted to mention that.
Okay, I'm gonna go ahead and stop sharing.
Yeah, and then Jennifer's gonna screen share now, and we're gonna have her talk about oral health screening before I come back and talk about other examples. So go ahead, Jennifer.
All right, let me attempt to do this. All right, give me a second. Presenter view. All right, are we good to go?
Looks good. Thank you.
Okay, perfect. Well, thank you, Sang, and that was some really great information as well, Sierra. And the one thing that I have always joked about is, that the mouth is the forgotten part of the body, even though it's attached to everything. And that it would be wonderful to have a district hygienist or a hygienist in some of these, these school-based wellness centers. So with that being said, I'd like to say just good afternoon to everybody. My slides are a little bright just because I feel like it's after lunch and we need a little brightening up. But I just want to say thank you guys for attending and recognizing the importance of student screenings in schools to promote health equity. And that I do see some familiar names on here. But as I mentioned before, for those that don't know me, my name is Jennifer Nwatney, and I am a registered dental hygienist in alternative practice with the Friendly Flosser. And I'm also a community partner that offers mobile dental hygiene services throughout San Bernardino and surrounding counties. So with that being said, what is oral health? A lot of times I feel like people think it's just cavities or, it's just bad breath or things like that. But oral health actually refers to the overall health of your mouth, including your teeth, your gums, the structures that support them. And it also plays a critical role in a person's overall well-being, which I think we kind of forget about. With over 25 years, as I said previously, working in the dental field, I've witnessed how oral health has remained a low priority despite the importance that and how it impacts our overall health. And so that's pretty much what has fueled my passion to educate and promote oral health awareness, especially within underserved communities. So today we're going to talk about the prevalence of oral health issues in children, the impact on the academic performance that it has, the benefits of early detection, addressing some health inequities, what a screening program might look like for some schools, and how schools can make a difference. So as I mentioned before, oral health is linked to whole body health. So through early intervention and education, we can hopefully help reduce the risk of cavities, gum disease, and infections in children, which in turn can possibly help lower the risk of conditions like what I've listed here, where poor oral health has actually been linked to contributing factor of heart disease, diabetes, respiratory illnesses later on in life. So making an impact early can make a difference for that child's overall health. So cavities in children is still a problem. And despite advancements in dental care, you can see that the statistics that I've noted here from the CDC, cavities still remain a widespread problem today. Tooth decay is the single most common chronic childhood disease. Children age 5 to 19 from low-income families are twice as likely to have cavities compared to children from higher income households. And 46% of children between ages 2 to 19 will have an untreated cavity or filling in one or more teeth. So cavities often start in childhood due to diets that are loaded with sugar, convenient processed snacks, especially like these new go-go squeezes and go-gurts and things like that. We assume it's a healthy snack, but they're very high in sugars that a child is kind of snacking on, and introducing those sugars repeatedly to the teeth, increasing their chance of cavities. And then a lot of times early signs of cavities often go unnoticed and untreated until it becomes a problem. So what does poor oral health, how does it impact our academic performance? So poor oral health has actually a direct impact on chronic absenteeism in schools, and it creates a significant barrier to academic success. So according to the ADA, children with poor oral health were 3 times more likely to miss school due to dental pain. Students that were having dental pain are 4 times more likely to have a lower grade point average than children that don't have any dental issues. And dental problems are responsible for approximately 51 million lost school hours per year in the United States. So by addressing oral health issues and implementing some type of dental screening into your school could potentially help to address some of these issues early on and reduce absenteeism and help students stay on track academically. So what are we looking for? Dental screenings are more than just for looking for cavities. School-based dental screenings can help detect and inform parents about issues before they become a problem. Um, but during a dental screening, a dental provider will also assess not just for cavities, but for hidden infections, like in the first slide. That's not a tooth that's coming in. That's actually a very large abscess that we did see in one of the students that we saw at a school site. And thankfully, the parent was on site that day and was able to make an appointment to get that looked at, because that's an infection that's running through their entire system. The second one is, basically what we're kind of assessing is this an early indicator? Is it a cavity? So the decalcification is basically the step that happens before a cavity starts. That's where the enamel is being broken down. And those, hopefully, if we can see those children in time, then in place of fluoride varnish, or at least let the parent know of the concerns about that issue going on, we can address it before it becomes a cavity. And the third image is something that a lot of us don't like to think about, but unfortunately it does happen. And that is where we're actually screening for any potential signs of neglect or sexual abuse by a caretaker, potentially, which, as I said, it's something that a lot of us don't want to think about, but we do see it happen. And it's something that hopefully, if it is happening, it's a cycle we can stop. So I'm sure we're all feeling the pain at the pump with gas prices right now. But for some families, the cost of taking time off work and driving to a dental appointment versus other necessities, it's a real struggle. So by providing or allowing a provider to come in to provide dental screenings on site, can really help to alleviate some of these issues that families may have as far as access to care. Some of these issues could be things like maybe there's not a Medi-Cal dental provider in your area, or if there is, there's long wait times for appointments to have your child seen or have issues resolved. some families, they're uninsured or underinsured. So, especially depending on the family's immigration status, sometimes they are afraid to file for Medi-Cal dental, even though they can get those benefits. So that child, unfortunately, doesn't get the dental care that they need because of that fear, which also fear and anxiety in a dental setting. There's I'm sure at least a few of you that are not fans of going to the dentist. Um, and that's a real issue. So if we can be on site and provide the dental screenings, a lot of times those children that we see, they want to participate. They see their friends participating. They see their friends not having any issues. We make it fun for them. So a lot of times the children that don't want to participate at the dentist, we actually can get in there and we can do treatment. We can take a look in there because they're in a familiar environment and they're comfortable. So that's a great thing to help in alleviating some of that fear and anxiety. Lack of awareness of the importance of oral health. A lot of parents just think baby teeth aren't that important. They're going to be losing them, they're going to be replaced, so they're not really a priority. But what they don't understand is they need those teeth for jaw development, for growth, for speech. A lot of things that we don't realize our teeth do, we need those teeth. So lack of awareness. The other thing is just another lack of access to care is maybe other competing priorities. Maybe there's a housing insecurity. Maybe there's other family health issues and job instability where taking that child to the dentist isn't a priority. So allowing a provider to come in and provide these screenings or dental services on site can really help to benefit that child and alleviate some of these issues. So how does it work? So every dental program and provider may do it a little bit different, but our goals all remain the same. We all want to try to minimize missed class time, providing a lot of times for dental screenings, we'll provide the service inside the classroom. We'll typically set up in an area that is kind of toward the back. We'll pull a few children up to be screened, and then it usually only takes about 1 to 2 minutes per child. The teacher continues doing what they're doing, and then once we're finished, the child just goes back, sits down with the rest of class. All we need is a flashlight and a mouth mirror. So it is a passive consent since we're not doing any type of treatment for a dental screening. If you were wanting to do something more involved and provide services, that would require an active consent. And that's something that you would discuss with your provider. But for screenings, we try to make it as simple as possible for the children, for the school site, for the teachers, all people involved, so that we have a successful event. These are the kindergarten assessment forms. I'm sure some of you are familiar with, or most of you should be familiar with those. The first one is the opt-out letter that usually is sent home. That's the passive consent form. The parents that return that form and state they do not want their child to participate, those are the children that would not be screened. Everybody else, if a form is not returned, then we would go ahead and complete the dental screening. During the screening, the front portion is filled out with the child's information, and then the back portion, the third picture there, would be filled out by the dental provider. And then typically we will leave a copy, or we'll leave the original of that with the school staff. So that way for those kindergarten assessments, you directly have that. So you can put that into that child's file and you have it so that you can report that into the score system as well. And then if you need to access these forms, you can find those at www.ab1433.org, or you can just ask me at the end, or I can give you that information as well. So these are just some of the districts that we partner with. Thank you to everybody who allows us to come into their schools and provide services and dental screenings to their students. We really appreciate that you are putting their dental health as a priority, as well as their overall health. So, you know, there's several districts that are doing this, not just with the Friendly Flosser, but with some other providers. And if it's something that you want to implement into your school, then there's several things that you can do. You can reach out to one of the partners that offers the dental services. Like I said, we all do things a little bit different. So reach out and, you know, select a partner that suits your district's needs. Some larger districts will even have multiple partners depending on what services they would like to offer. Sometimes it's just the dental screenings. Sometimes they'll offer sealant programs, fluoride varnish programs, or full hygiene program services. If you're not part of the Smile SBC work group, I would encourage you to do so and get more information about that. They're an excellent resource on all things pertaining to oral health and pointing you in the right direction if you need any help or assistance with implementing a screening program into your school. And then you can also implement it so that it's a yearly event, just like hearing and vision. And you know, partnering with whoever your dental provider may be or Smile SBC, and offer trainings to your health staff. A lot of times, you know, the medical field, even though they know all that medical stuff, they're scared of the mouth. They don't know anything about it. So, you know, don't be afraid to ask either your provider or the Smile SBC for help in getting information on training your staff. So thank you so much for, you know, listening to me and my topic about oral health and, you know, why I'm passionate about it. And if you don't currently have any type of dental screenings or services in your district, I hope this has sparked some interest in how it can be done. So thank you. Any questions? Or are we waiting till the end for that?
Yeah, why don't we just take questions the last couple of minutes, although I know we don't have that much time left. Go
Okay.
ahead and stop your screen sharing and then I'll bring mine back. But yeah, I used to go to the oral health screenings events that we used to do in LA, and they were just always so fun, especially with the young kids, the kindergarten, first graders, and then they all go home with a toothbrush for that day. But let me walk through like I think one case study, and then I'm actually gonna advance those slides and turn it over to Sarah to kind of wrap us up with some announcements. But we talked about STD screening, we've talked about, you know, mental health screening. Jennifer just went over oral health screening. Let me just touch base on asthma screening, which to tell you that there's just a wide range of health topics, right, that you can really think about to screen with your students, you know, classroom population, you know, school population, what have you. And so we had a 3-year program where we were working with a number of school-based health centers to really think about how to do asthma screening and early and just, you know, chronic case management. And so here I'm going to talk about Fremont High School, which I mentioned earlier. They were part of our learning collaborative, and so they have a student population of about 2,200, and they knew from LUSC data, Healthy Kids data, that about 200 students actually have asthma. And so while a number were already identified, what we really wanted to get a hold of was who else, you know, needs to be identified that has asthma, so that way they can get connected to the school nurse, have an asthma action plan, and really help to drive, the chronic care element to the school-based health center, so that way it will reduce, their chances of ending up in a hospital, or an ER, which we know will be much costlier than saying, being seen at a school-based health center. And so what they did was peak flow screenings during all visits for non-confidential services. So everybody who came and got services got a peak flow screening, and then also did what we call mass screenings through a questionnaire. Then these are validated tools that you can use. And I think that the item that they used, I think, had maybe 4 items. The questionnaire they used had 4 items, and they did this with the collaboration of the school nurse. And you can do this during welcome, back to school night, and parent night, or what have you. And so really that's the population level component to some of these screenings. And then once students are screened positive, then they would get followed up by the school nurse, get on an asthma action plan, what have you. But really, again, early, identification and screening, and to really do that chronic care management that school-based health centers are really known for. And this picture I'll show here is that in addition to the screening that was happening at the clinic, their youth board also got involved by actually doing another school-wide intervention where they would actually look at the forecast for the day, and to look at the air quality. And if it was, a day that maybe had unhealthy air quality, either the red or purple flag, they would put that particular color flag out in front of the wellness center to alert students to say, hey, if you have asthma and you have PE that day, that might be a day where you spend the day inside, with permission from your PE teacher. And so again, a screening intervention, but then also a health promotion intervention, as well as just your general environmental, piece to that. Okay, so I'm gonna stop there and then actually advance. All of this information are additional references, but I want to get to, Sierra already popped in the chat some, the tool that you're seeing on the screen. But I really want to wrap up by having her share a few announcements that we have coming up. Many of you already know about our coalition. We've got a school-based health symposium next Friday. If you haven't already registered, we have about 25 seats left, I think. And registration will close on Friday. We'll put that into the chat in a little bit. But here is a QR code to register, as well as get more details. But Sierra, wrap us up in like 2 minutes.
Sure. Very quickly. So we have the California School-Based Health Alliance has our annual school health conference, which is going to be April 28th and 29th at the Hyatt Regency in Orange County. We don't have registration up yet, but just save the date. Saying next slide. We also have our Youth to Youth, or Y2Y conference. This is a conference that is for youth by youth. So all the presenters are young folks. This is going to be Friday, November 15th from 9 to 3 at the IEHP Atrium in Rancho Cucamonga. We would love if you all have young folks to bring. You can go ahead and take a picture of that QR code, and I think we're going to share these slides afterwards, so the link will also be in there. Next slide. We have 3 grant opportunities that I'm going to share very quickly. Unfortunately, the spacing got a little bit messed up on there, but the first one is we're launching an ACES learning community. It's going to be a great space with collaborative learning and individualized technical assistance. The school-based health centers have to have Medi-Cal providers and be interested in launching ACES screening. And if they join the learning community, they'll get a $10,000 grant. So if you're interested, there's a QR code. There's also a webinar where you can learn more about ACES screening, adverse childhood experiences, and also learn more about the learning community. Next slide. We have we're partnering with Stanford to evaluate their Healthy Futures curriculum, which is an alternative to suspension curriculum. It's a randomized trial. There's follow-up surveys. The control group, what's nice is that they won't, usually control groups don't get any type of intervention. They will get intervention in the second year, get trained on the intervention in the second year. It's a 3-year commitment with $10,000 each year. High schools, it's unfortunately only for high schools, and high schools have to be larger than 1,000 students. So if you're interested, go ahead and click on that link. And then the last one is we have our 2B grant opportunity, which is looking for 5 sites, school-based health center, wellness centers that have youth advisory board, peer health education, something along that lines. Basically, we're going to be training the adult allies who will then train their youth, who will do some type of larger outreach to the school on tobacco and vaping prevention And they receive a $4,000 grant to be part of it this school year. And then there's the QR code. Sorry, I know we're over time.
No, thank you. I'll turn it back over to Mara.
Thank you, everyone. I'm gonna go ahead and have, because of time, just have Karen just put the survey for feedback on the webinar in the chat, and then the live binder links. And then we're also going to send out a follow-up email so you guys can have access to the slides and all the resources that was shared in today's webinar. But I do want to thank Sierra, Sang, and Jennifer for today's webinar. It was very informative, and I hope it was beneficial for you all. Thank you.